Good afternoon, everyone. Sorry we are a little bit late, but it's always better to be here than not being here. So today is November 19th, and this is United Medical ACO Weekly Updates. I have Sean Donovan with me, and he is gonna be part of our discussions for today. And apparently there is something at the end of it, which I have no idea what it is. So we'll find out all together. Hopefully it's nothing bad. So I do want to just send the link to our people first. And in the meantime, so we can actually start the discussion. All right, so I hope everyone can see everything, and we should go ahead with our updates. So Delaware Health and Community Updates is something that we do on a weekly basis. Our goal is to communicate with our patients, our employees, our friends, and that's what we are trying to do here. And hopefully people are appreciating the news that they're getting directly from their healthcare providers. So today we are going to discuss the vaccine updates, future of healthcare, potential use of mRNA vaccine for others, and the victim of digital media, Bill Gates, and some other topics that we have. But before we start with other topics, I just want to have this refresher for our patients. This year at the primary care level, we have completed 194,000 appointments. This is 10 months. This is Delaware only. And there are about close to 450,000 total appointments, including the specialties. And that's where we are right now. So in terms of providing care for active community members in Delaware, we are probably a little over 12% for the entire population, which actually is a higher percentage for those who are looking for active care, because there are so many people, they don't go to their doctor appointments, but the ones who are going, that percentage should be higher. United Medical is an integrated multi-specialty healthcare network, and we as we provide the care, we call what we do as we are Delaware, and but this is not limited to Delaware only. So as of today, 37% of the healthcare workers are still unvaccinated. Actually, this is September, I apologize. This is the CDC data. So before we go to our vaccination update, I think it would be important to have, this information would be important to have, because healthcare workers not being vaccinated, actively being in touch with patients, that's not something that we can afford, honestly, because if there is, imagine that 30% is, half of it is being impacted by the vaccine, the not having the vaccine, the impact could be huge, and therefore we are urging those who are in patient care day to day to get vaccinated. So Sean, you're going to give the updates on the COVID numbers?
Yeah, definitely. Yep. So we look here, we have our updated chart for our global daily statistics with our COVID-19 infections. As you see, it's still on the rise in about 54 countries. If you're looking at United States there, we are on an average increasing rate over the last 2 weeks. So it looks like we're up, having around almost 90,000 new cases. But in good news is that our average decreasing death rate is going down. So if you look on the right there, United States is on a downward trend regarding the deaths. So hopefully if we can just get the actual cases to turn around, start going on a downward trend too as well, that would be great.
And people should be always careful with those numbers. From United States standpoint, I know the data actually is going to be more accurate. I do not believe that is the same for some other countries. Mm-hmm. So we are just providing what's out there, but my personal belief is that, like for example, India, this number is much higher than 348.
Yeah, most likely. Yep. Yeah, so then here, another chart we have with our global vaccinations. So if you look at the top, Cuba did pass the threshold there, which is enough to have 2 doses given to 120% of the population. So that was a big milestone for Cuba. And again, I think this is including the top 15 countries there. The US is not in that top 15 list. However, we do see on the next slide, looking at the United States, it has data for us, and assuming that every person needs 2 doses, it looks like we have enough for around 67% of the country's population to have been vaccinated. And if you look down there on the bottom graph, you see that steady uptrend with the doses going up over time as we approach the Thanksgiving and holiday break and the end of the winter here coming up.
Well, Sean, are you going to your parents for Thanksgiving?
Yeah, so I'll be heading up to New York. We're actually having it at my brother's house this year, so that'll be exciting. But yeah, going back to New York. So only 3 hours. So hopefully there's not tremendous traffic. But
is everyone vaccinated?
yeah, so we're excited to get back together. You know, 'cause some of my other siblings also live, you know, about an hour away from home or so. So it'd be nice to have everybody back together.
Sure.
For sure.
If you don't mind me asking, your parents, you don't need to say exact ages, but the age range, are they on the younger side?
So yeah, they're at the retirement age. My dad's retired. He is in his 70s, and my mom is younger. She's in her 60s right now. And then my siblings are all in their 30s. So they save the best for last. Here I am.
So overall, in the United States, the total vaccination numbers.
Yeah, so here, if you're tuned in last week, you have noticed that from last week to now, we have around 5 million more people did receive the booster shot dosage. You see that number now up to 31.5 million. And then right above that, it's going to show us our people fully vaccinated, which had just over 1 million more added to that. So last week, it was around 194. We're up another million. And then overall, if you look at our percentages there, in that top row in the far right column, we are up 1 more percent. So we went from 67% last week with the total vaccination. Now we're up to 68.7%. And again, this is as of November 18th. Oh, I think you're muted, so.
Yes, I am. So from Delaware standpoint, our total numbers, so we don't have new numbers on the breakthrough, so then we're just presenting the what's available. So the total fully vaccinated total number is 540,000 and 494,000, almost 495,000 people. They have 2 dose series, so which is like in total we are still lower than the US average. That's kind of interesting from that point. So I think I ate one of the fruit flies, so I did like so I'm gonna try not to think about it. All right, so now, well, before we actually go with the Delaware to the other detailed vaccine numbers, apparently this week or today or something around this week is the Children's Day. So I got a message as a reminder, and I'm like, sure, we'll include it. But if we are and the next week is the family. So if we are going to celebrate Children's Day, it would be important for us to know where the pediatric vaccination numbers are. And the pediatric vaccination numbers are not so promising yet, just to kind of see what's available between the 3 different vaccines, Pfizer, Moderna, and J&J. 4 years and under, there's no vaccination available. 5 to 11 is so far only with Pfizer. 12 to 17 also is only with Pfizer. And the rest of it is 18 and older. They can get either one of these 3. So there are, of course, for anything, any other vaccine, there are some side effects, but it's nothing different than what we have seen with adults. And it's definitely important for them to get vaccinated. So this graph, Sean prepared this, but it was kind of confusing with what we are comparing here. So I'm going to use the help of our drawing. So these numbers, although this pink bar here looks kind of very high, what that is it's just the total vaccination in that age group, and age group is this guy here.
Yep. Yeah. So if we're looking at that top category, that's the less than 12 years of age group. So that gray bar is going to actually represent the percentage of the U.S. population in that demographic category. So that's showing you that looks like somewhere between 10 and 20, so maybe like 14% or so of the U.S. population is under 12 years of age. And then of that, there's going to be
this number here, right?
Yep. So yeah, 14.4%. Yep. And then right above that gray bar is going to be the maroon bar, which is showing you of that gray bar being the total population of children under the age of 12, what percentage of those have their at least one dose. So that's going to be the maroon bar. And then another subcategory of that maroon bar is of the children with at least one dose, what percentage of them got that vaccination in the last 14 days. So that's where that light pink bar at the top is looking. It looks really large, looks like a really big number, but it's just showing you that just over 30% of that total category did receive their vaccination within the last 2 weeks.
And that's only 4% of the that age group. Now, keep in mind that there is no vaccine available for 4 and under. Mm-hmm. So maybe that's actually a little bit higher than that, but it's a very small percentage so far. If we are going to have the Children's Day recognized as one of those national holidays, I hope we don't have to be off those days.
Well, luckily, I did look it up. It is technically celebrated tomorrow. It's the 20th.
All right. So, well, these days there's always there's some special day for everything. So
that's right.
So we should have United Medical Day one day.
There we go.
So now, if the kids are still having issues with, if they're scared or they're having trouble with vaccination, they always can get a help from our best friends. This one is not Buddy. It looks just like Buddy, but better groomed. This is Oli, right? So, John, what is this guy doing?
Yeah, so I believe the left picture there looks like Ollie's actually going to help you with the check-in, can help you check in at the desk. Eager to help out there. But now, on a serious note, Ollie is there as a therapeutic dog to help comfort children who might be a little nervous, kind of help them, put them at ease, getting another vaccination. That children are always, afraid of needles, kind of get worked up. But, having the dog presence around definitely will help calm them down and, hopefully increase the amount of children willing to go get the vaccine.
Yeah, I wish I could use my dog as a therapy dog, but all he does is bite people, so I won't be able to use him. Right. So now our next topic is when we are preparing for this session. In some weeks we don't have a lot of new items, and we do a lot of readings in healthcare related to our fields. I personally spent about 2 full hours with our nurses just on the clinical side with going over patient cases. And the other than what's happening with pandemic, what's a bigger picture, what's happening with actual healthcare and how we can actually advance to the next level. I find this new article kind of interesting, and I would like to have maybe one of our doctors in the next couple of weeks to join us and then explain this in maybe in a different way. But I want everyone to kind of see what I'm seeing. So the future of healthcare and how actually this mRNA vaccination methodology of mRNA can be utilized in different areas. So we kind of prepped this for you, and hopefully this can be opening this discussion. So Sean is going to give us the intro of this discussion.
Yes, as Kemal mentioned, we're kind of trying to include healthcare, holistically in some of these discussions. So not just always focus on, the COVID pandemic particularly, but kind of just advancements, overall. And one of the articles that we did come across mentions, the use of the mRNA strand and kind of the groundbreaking technology, as you see there in the title, that can definitely change the course of medicine, as we progress forward, in the near future, hopefully. So in this case, we did kind of focus on cancer being the particular topic, specifically in this case. So we did just include a brief intro here, kind of just giving people the background of, what cancer is. So, it's kind of the uncontrollable growth of cells. Sometimes there's a genetic mutation where there won't be the stop codon. So cells will continue to divide uncontrollably. And if you look at some of the differences there on how cancer cells do differ from the normal cells, you'll see that sometimes they do hide from the immune system. So our bodies aren't able to fight and attack, the quote unquote bad cells. They can also accumulate multiple changes in their chromosomes. And that's kind of where this mRNA piece kind of incorporates in on how that genetic, replication and coding is kind of be factored in. And then a little bit further down, we just have quick cancer facts on just to give you sort of a scope on, the magnitude of how many people, are impacted by cancer. So again, these numbers are referring to the United States, but if you look in 2021, it's projected that around 1.9 million people will be diagnosed in the most common type, breast cancer. And, down there at the very bottom, we have an estimated of 608,000 people, unfortunately, will die from a cancer-related cause. So that's why, we're kind of focusing cancer in with this mRNA to show, what kind of larger impact certain advancements in the medical field could have, not again, just on the pandemic with COVID, but, as an overall overarching category for sure.
So, Sean, when I read this article first, I think what's really interesting is just understanding overall the progress of any of the disease and how it can actually impact, where we can actually have an impact. Like when we do the case conferences, it's already maybe too late by the time we find out what's happening with the patient. Now, with the cancer patients, one of the most important questions that we always ask is the stage of cancer. So, which makes something very simple, maybe if it's an early stage versus if it's already stage 4, it's already deadly. So between 1 to 4, there's life, right? Yeah. So the understanding of the vaccine technology, how it can actually be incorporated into this, there is the early detection part of the. I think that's the highlight of it, because as soon as you see that early detection, who can, what we can, who and what and where we can actually detect that. And the best tools today that we use for this is we have screenings, we have blood works done, and we have annual physicals and other doctor visits. So we look at our family history, and none of these are slowing down the process, or proactively it's just taking an action. Like the body is not actually smart enough when it gets to this level. And it's, if the stage is already on the higher side, then it's already too late. Now, when it made a lot of sense when I read this, I'm like, okay, well, maybe there is some light at the end of the tunnel for diseases like cancer. So if the early screening can be, early detection can be done, not only it can be done, but also if the cells can do something with it, right? We are not just detecting, but we are also, we are saying that in this case, it can actually take an action. So from this, I just want to kind of explain how the mRNA works. So then, let me see, so that we can kind of make it a little bit clear. This may happen or this may not happen. We are not saying that, the science can change anytime based on the findings. But the way that messenger RNA is working is it's transferring the genetic information from DNA, and it's used as a template, and it actually forms proteins, right? So it's giving the message, and it's using it as a template to form protein. That means if we use this technology in the specifics of cancer, and if as soon as the body actually this detection happens, then we can actually take an action. And that we is not us, like with the physicians and everyone else, but it's we as the body itself is already fixing that problem. So in my opinion, with the way that I think the technology of mRNA, this took 30 years to develop, and now, yes, maybe we are doing this with we are using it with the pandemic, but the technology itself can be used for the treatment of other diseases, including other genetic diseases. So I do believe that there's a huge potential. Now, how long will it take if we have enough data and enough testing done? That I don't know, but it's still early on. But I do believe this can be very useful for the future for those patients, because in some cases it gets very depressing when we look at these patients and we try to kind of make it more if the patient case is presented, the insurance company is kind of training us in a really wrong way. And when I say this, what I mean by that is, if just any case versus the case that we are dealing with is a person. So if that's a person, then it's not just any other product, right? So you're not oh, well, we make these phones or we make these, iPads. No, we deal with the actual health of the person, life of the person, the decision that our providers are making, the follow-ups that our patients may not be making. It can change the entire course of someone's life. So because of that, any technology can be used. It should be used, because it's so sad that you see someone and they already have cancer. They're 52 years old, 55 years old, 60 years old. And once that a lot of our friends, they lost their loved ones in a really early age. And this is something that we really need to actually push and see if there is any way of bringing better technologies for healthcare. Now you have, Eshan, you have one other slide that you prepared. Now, explaining the mRNA is always challenging and every time we do this, there's a better explanation. And just so that, just from this image, if you want to maybe just repeat what we have.
Yeah, so, as you mentioned, if you look at the top, we have the essential function, the main role of the mRNA is, giving that blueprint, the genetic coding from a cell's DNA, and it's actually going to bring it down, to the ribosome where the protein synthesis is taking place. So if you look up there on the image, we have the transcription. So from the DNA, the mRNA is involved in getting, decoding that DNA genetic code, and then it's going to then message, bringing the message, traveling to the ribosomes where the translation is going to take place. And that's kind of where tRNA actually is factored in there. But that translation is when the proteins are then going to be able to be built, created using the genetic code that the messenger mRNA was taking from the DNA of the original cell. So, kind of just basic, if you think, super easy, middleman, where it's taking the information from the DNA genetic code and it's going to bring it down the ribosomes. That way it can be used to create protein synthesis, create those chain links.
So If and we don't have to be a scientist to really understand what it can do. Like, because as soon as you look at the whole picture, the technology itself. I'm not saying this one for what we do with the vaccine, but technology itself can be definitely used, and I'm hoping that we can see more studies around this, and maybe 5-6 years from now, there will be a better, more effective treatments of other diseases.
Yep.
All right, so so Sean, I have a couple more weeks to make fun of you for being the new person, right? So this is the last
time
week.
is dwindling. Take advantage now.
So, who's the most misunderstood man in digital media? And the answer is not me, right? So, I was afraid that you were going to say you, but it's not me.
Right.
So, luckily, there is a different schmuck who's more misunderstood than I am. So, I think he, his intelligence level is so high, sometimes he cannot really communicate properly with the rest of us. So,
that's a challenge on its own right there, trying to relate to the common public for sure, a man of his status.
Well, let me ask you this. So why do you what's your perception or perspective of Bill Gates?
Yeah, I mean, if you think you're asking, a common person walking down the sidewalk, who's Bill Gates, the first thing that's going to come to mind is going to be the powerful man, CEO, Microsoft, all his role, obviously super wealthy. Everyone, I don't know if a lot of people should know, the Bill and Melinda Gates Foundation, all their donations and what the contributions they've made. But definitely just overall, I think a lot of people just think a wealthy and powerful individual for sure.
So, but why do you think, okay, if you ask me the same question, maybe just from the different things that we read, as soon as I hear his name with a lot of Illuminati discussions, like he's trying to take
secret agenda or something.
Yeah, trying to take the population down to 500 million. And trying to kill 2 billion people, this and that. And I saved, we rescued him last time. It was Tanner who was with us. And at this time, maybe it's with you. So we are trying to kind of rescue this guy from the trouble that he gets in. He's always misunderstood, or maybe the issue is if we are ready to misunderstand him. So we are kind of we made our mind up, and then whatever he says, we don't hear it.
Yeah, it could be definitely could be a predetermined bias that some people have towards him. Regardless of what he says, they're going to find a way to shape that into a picture that they kind of already have made up in their mind.
So what did he do this time? Let's see.
Yeah, so he had a recent interview, obviously discussing vaccinations, and I think he had written an article where it said. I'm thinking the interview he mentioned was back in 2015 when he initially wrote it, basically saying we are not ready for the next pandemic. And lo and behold, we were hit with a pandemic, COVID-19. And I think in this most recent interview, he was kind of discussing why we weren't, this is, both from a government, globally, United States, all different perspectives, but overall why we weren't prepared for what happened with the COVID-19 pandemic. And then he kind of also gives a take on what we kind of need to do for the future. That way we are prepared, for any future pandemic should it come down. And, he kind of made a joke about that he hopes in the future to be able to write an article titled, "We Are Ready for the Next Pandemic." But in doing so in this interview, he did have a couple quotes, and I think some people were misinterpreting and kind of taking them out of context on what he was saying regarding both the COVID-19 vaccines and then just overall government approach and the steps that need to be taken and that were taken to address a pandemic.
So, the way that I think that today's society, that what I see is we don't want to be accountable. We don't want to be, and I'm not saying we as individually, but people, they don't want to be accountable, and they just want to, there's a lot of entitlements. And honestly, when I read or listen to what he says, the guy is saying that, look, we have to prepare for unknown. This unknown, if we had any preparation for what was coming, we would have a plan of action. So then we would be able to actually, we would be more proactively treating what's happening. And then a lot of people who didn't know anything in the beginning, if we were to, I think it was February, March last year, in 2020, if we were to be better prepared, the total number of people who lost their lives is about 750,000 just in the United States. That could have been maybe only 100,000, but still we don't listen. So this guy is, I think I see some, every time I try to plan for something or I try to prepare us for something, our company, or like any unknown that may be happening, like, like you never know if X is going to happen, but if you don't have any plans when that X happens, you have to have some plan in place. Not having that plan in place is disaster. So people are reading him and making, I think deliberately, they're just representing him in the wrong way. And but he should actually learn from what the troubles he got. Like he should be a little bit better with the choice of his words. And I don't know, like I feel sorry for him every once in a while. Even my dad thinks that he's trying to kill everyone, and then we're going to go down to 500 million. So he's going to be probably upset if he hears this, but because he doesn't speak English, so he won't know. So as one of my siblings said something. So, but he thinks that this guy wants to, take the population down to 500. Well, let's say he did it. Like he's not going to live forever, right? So what's
his benefit? Yeah.
What's the benefit, right? So, but I think we do want to bring these things time to time and make sure that people understand. Now, one of the other things that I do want to actually discuss, one last item before we finalize today's session. So this is another thing that I tweeted this week, the overdose that's reached record high. And this is actually, by itself, is a huge pandemic. Like it's a lifetime pandemic that's happening. And I don't think we are taking actions on this issue the way that we are taking actions on other problems. So 100,000 people lost their lives for overdose. So that 100,000 people, that's 1/7 or 1/8 of the total COVID numbers in 1 year. Not in 1 year, in 1.5 years.
Yeah.
So
total, yeah.
And I think this should be taken more seriously. And again, we are talking about overdose. That means someone is taking way more than what they're supposed to be, like drug overdose. These are narcotics. So,
and I think I was just going to say, obviously an underlying point here is that, this is obviously something that could be extremely preventable, different programs in place, different outreach. I know a lot of officers have the Narcan, I believe it is, the chemical to help if they come across someone who has OD'd. But, if we're talking about, comparing the overdoses to the COVID, we could still say, COVID's fairly new. We don't entirely understand it. But if you're looking at something where I feel like we have a pretty good understanding on, how to prevent this, what we can do, what steps to take. That way we can sort of mitigate for sure and definitely, turn the trend in a, more positive, light. It's definitely something that there's ways that we can definitely impact it. And that's kind of the difference there.
Definitely. So, well, a little bit on a more fun topic. So this is something that you wanted to share, right?
Yeah, so I was just thinking, maybe going forward, we kind of have, political cartoon of the week. Obviously, this one here, saying side effects of the guy being delusional, the price will drop. And I know one of the themes that we do discuss in our UMACO meetings a lot is kind of just the cost of healthcare, and how certain, say, medications, for example, are way more expensive, from a different provider, different dosages, or whatever the factor may be. And then just overall, healthcare costs. We always mention that hospital visits are way more expensive than if you went to your PCP. So it's just kind of threw this one in there, just having an impact on the overall cost of healthcare.
That's actually it is the reality, unfortunately. Now we would like to do another maybe if it's not every week, every other week, we want to actually bring up the book suggestions. So, Sean, way before you join us, this was in 2014 was the first one, I believe, maybe earlier. So we used to do in-person retreats, and I would have upper management and middle management with me, usually about 18 total, and we would have 2 days. We actually would spend 2 days, 2.5 days with the entire management team. And I do miss those days. And I'm hoping that maybe 2022 would be something that we can actually start doing that again. Although we increase our communication skills, communication methods or communication channels more effectively, utilizing those and communicating with our people, but still missing that in-person personal touch. And one of the things that we used to do is I used to assign books, and then we would discuss those books. And for those who are interested, and also I should mention Randy Munson. He's as a part-time, he works with me as an advisor, and he has done a lot of stuff with me in the last several years. And so this is one of the books that we choose at that time together. So this is Good to Great, Jim Collins. I have this book, I believe, in our library here at United Medical, but we bought this for all of our managers who were going through those retreats. It's a really good book. Most people would understand exactly what the system's supposed to be doing. Then many people also will understand. One of the common saying that I use is "Don't kill the good for perfection." So, or the perfection is the enemy of good. So then they will better understand what I mean by that when they read this book. So, in order for us to in business go through and advance, we have to be able to have a good team in place. And this team, the way that we choose these people who's on and who's not, this is all important, and timely decisions is extremely important. So I'm hoping that people would enjoy reading it. Again, the book is called Good to Great by Jim Collins, and it's a wonderful book. Now, Sean, I have no idea what's coming. But Susan Anderson, our Chief Operating Officer, came to me right before the session, and I said that at the end of this session, can we have 20 minutes? I don't know what is in that 20 minutes, but I promise you, I had zero idea. I did actually guess something, and I put it here, so you're my witness. So that may be what it is. So let's see how good I am. But I have zero idea. So there is some type of a surprise, which I hate surprises.
I won't spoil it, but I believe the link was sent to them where they can join in and get the ball rolling here.
Yeah, I'm gonna let Susan in. So 100%, I have zero idea what's coming. So let's see what's gonna happen. Good. Just to remember that I hate surprises.
Here's the story of a lovely lady who was bringing up 3 very lovely girls. All of them with hair of gold, like their mother, the youngest one in curls. Here's the story of a man named Brady who was busy with 3 boys on his own. They were 4 men living all together, yet they were all alone. Till the one day when the lady met this fellow, and they knew it was much more than a hunch.
gratitude for all you do. You're innovative, you lead generously, you advocate for excellence, partner with the community, and expect integrity. We appreciate you.
For negotiating better benefits and putting
And promoting autonomy and the responsibilities of our jobs.
for the encouragement of the staff and
Tired.
supporting employee engagement, and affording us opportunities for career growth.
Thank you, Kemal. Happy Thanksgiving.
We just want to take a minute to say thank you for our service. I just truly appreciate it. Thank you for this opportunity.
All your leadership has helped and inspired employment both professionally and personally. And I want to say thank you. 1, 2.
Thank you.
Thank you.
Hi, Kemal. At this time of year, I get to reflect on things that have been important to me. And one of those things is you. I want to thank you for all the opportunities that you've given me throughout my years here, promoting me to client manager. And the most important probably was allowing me to keep a job with the company when I moved to North Carolina. I wish you continued success. And I just wanted to thank you so much for all that you do for me.
Hi, Kemal. I would like to thank you for your vision, your extraordinary ability and leadership in guiding us at all times. Also, I would like to personally thank you for giving me the opportunity to help grow and develop the clinical department here at United Medical. I feel that your innovation has led United Medical ACO to success in the healthcare community, as well as with our value-based contracts in just a few years. I appreciate all that you do for the company, as well as giving back to the community we live in. Thank you and happy Thanksgiving.
Thank you for your coordination and happy Thanksgiving.
Us here at United Medical Clinic Call Center would like to give thanks to you for showing us true leadership and for the opportunities you give to your employees.
For your generosity.
Creating a professional work environment.
During the pandemic.
Guidance and encouragement from the team. And we're thankful for this program opportunity and being the first co-op team.
Hey, Kemal. I probably don't say this enough, but I just want to say thank you. Thank you for all you do, for CREAS, for ASC, and for our community. You are a true gentleman, you're a true statesman, you're a true leader, businessman, and philanthropist. Very thankful that you're in my life. I appreciate you.
Thank you so much for everything you've done for your employees and for United Medical.
Happy Thanksgiving in our new house.
Hello, Kemal. We finally moved in last night to our retirement home. Yes, retirement home. Again, thank you for giving us the confidence of proceeding with this project in spite of the pandemic. Thank you for the friendship, and most of all, thank you for the love.
Hey, Kemal. The year is coming to an end. It was former President Reagan who said, I'll ask the question, are you better off today than you were 1 year ago? I think as I miss you, we're better off today than we were 1 year ago, thanks to your guidance and support and leadership. And our numbers are looking good, and we have reason to be optimistic, cautiously optimistic. So, gracias.
There are many things that I'm grateful to Kemal for, but the most important thing would be his generosity towards people who are in need and also animals. I think that this has taught all of us that we should be very generous towards those that are in need and always put others before ourselves. I'm very grateful to Kemal for all the philanthropy work that he does, and I will continue to follow in his footsteps as well. Thank you, Kemal, for everything you do.
On Thanksgiving, it's a custom to thank people who have made a difference in our lives. Without doubt, I can say that Kemal and United Medical team has made a difference in our lives. Thank you, Kemal, for what you do for us in ACO and more importantly, for our patients. Thank you so much for your dedication and your devotion for ACO, our patients. Again, have a good one. Happy Thanksgiving to everyone. Thank you.
Hello, everyone. I want to say thanks to all my United Medical family. I feel very grateful for all the support and trust that was given to me. I want to say thanks to Kemal and John for making all of this possible. I wish everyone a happy Thanksgiving Day, and I will see you soon.
Hey, Kemal, this is Ripu Hanbol. I'd just like to thank you for your help all the time for all these wonderful 10 years that I've been with you. The most striking features that you have, or your qualities, I must say, is being so humble, so friendly, patience, like as you always will spend extra time to get the things done and never shy away from work while looking at your watch and say, okay, I need to go. So I really admire your qualities, and you have helped us a lot for all these years. I wish you very best health and long, healthy life. Thank you. Good to be your friend.
Okay, hi Kemal.
Hi, Kemal.
Okay, this is already like take 10, and I laugh when I'm nervous, so I'm just gonna say it. We are thankful for your friendship. I know we butt heads all the time, but I know you have a good heart. So we wanted to greet you also. Happy Thanksgiving.
Happy Thanksgiving, Kemal. Thank you.
See you. Bye.
Hi, Kemal. Another year has passed by and it's Thanksgiving time again. As you know, this past year was special for us as we started new practice, Kidney Care Associates. And on this Thanksgiving time, I want to thank you for all your support. Thanks to yours as well as entire United Medical team's hard work. And I know that without you guys' support, it would not have been possible. So happy Thanksgiving. And I wish that your Thanksgiving Day will be full of fun and excitement. You rock and keep going.
Kemal, thank you for your leadership and everything that you do for us.
Hi, Kemal. Happy Sweet 16 to United Medical, and thank you for making me part of your team. And that was 8 years ago. You just didn't give me a job, but you also gave me a work family. Thank you for keeping us safe, and also for giving me opportunity to work while taking care of my kids. And say hi, Mr. Erkan. Hello. Again, I'm happy and thrilled to be still part of your team. Thank you, and happy Thanksgiving.
Well, thanks for being part of your Thanksgiving.
On behalf of United Medical Clinic's Smyrna location, we would like to thank you for inspiring us to put others' health first. Thank you.
Thank you, Kemal. Happy Thanksgiving and happy holidays. Thank you.
Thank you, Kemal. Hi, Kemal. Happy anniversary, United Medical.
We thank you for your leadership. Bye.
Happy Thanksgiving, Kemal.
Happy Thanksgiving.
Thank you for all your
taking
support.
us.
Bye.
Thank you, Kemal and United Medical. We are grateful to be part of the team providing service to our community.
Thank you.
Thank you.
Kemal Day, our wiser younger brother, 20-year fierce friend, and unstoppable business leader. We thank God and you for your guidance, knowledge, strength, and enormous heart. From all of us at First Aid Healing Practice, thank you. Sene Sefialum Regasum. Choke Asa.
Hi, Kemal. We would like to take this opportunity to thank you for all the hard work that you've done day in and day out for both the UM Clinic and the UMACO. I think a lot of our success has been mainly through your study leadership. we wish you continued success and good health. Happy Thanksgiving and thank you.
Thank you.
Bye-bye.
I am personally thankful to Kemal for treating me as family and for respecting my opinions and for tirelessly listening to our concerns and complaints through the years. It's been a pleasure working with you and working for you, and happy Thanksgiving.
Happy Thanksgiving, Kemal, from all of us here at UMC.
Wishing you the best this holiday season.
Happy holidays!
Hi, Kemal. Hope you have a wonderful and blessed Thanksgiving. Don't eat too much turkey.
Thank you from the Dover office.
Hey, Kemal, thank you for everything.
Hey, Kemal, we just wanted to say thank you for all that you do for us and for the company, and to wish you a happy Thanksgiving.
Happy Thanksgiving!
The constantly evolving requirements in healthcare have made it difficult for us to practice medicine. Kemal has made it a bit easier for us independent practitioners to adapt to those changes. Kemal, thank you and happy Thanksgiving to you and to everybody at United Medical and United Medical ACO.
Hi, Kemal. I would like to thank you for everything that you do for us. Happy Thanksgiving to you and dear buddy. Take care.
On behalf of Business Development and IT, thank you, Kemal, for everything that you've done for us, for everything that you helped us with. And happy Thanksgiving. Happy Thanksgiving.
So hi, Kemal. We are so, oh my God.
Surprise! Hey, Kemal. What a crazy video, right? You got everyone saying, you know, their thanks and everything, and we have a special thank you for you too. Take it away, Hazel.
This is your all-around department. We all want to let you know that we are so blessed and we are so fortunate to be led by you. You not only granted us the opportunity to work here, but also gave us a workplace like home. So thank you. Thank you for everything that you do for us, and we love you.
Thank you.
Hi, Kemal. I just want to take a moment to thank you for everything you've done for me, both personally and professionally. You've always been so incredibly generous with your time and knowledge. Your passion is such a motivator for so many of us, and you deserve so much credit for what United Medical has accomplished. Thanks again.
Hi, Kemal. I just wanted to say thank you for being such a great boss and a phenomenal person to work for. I appreciate all that you do, and every day I'm thankful to work at United Medical. Happy Thanksgiving.
Kemal çok iyi bir insan ve çok iyi bir önderdir. Kendisi çok akıllı, karizmatik ve ileri görüşlüdür. Kendisinin beklediği hakkında çok övüyoruz. Kemal, Delaware Advocacy için de çok güzel bir iş yaptı. Bütün saydığı kualifikasyonların üzerine kendisini çok iyi bir önder ve iyi bir iş yapabilir. Üstelik kendisi çok yakışıklıdır. Her şey için Kemal sana teşekkür ediyoruz.
I believe it's been almost 10 years since I met Kemal the first time. He was starting his business and I had no idea that I would be having mine. 6 years after that, he took a leap of faith by helping us as a startup with our pathology business. And since then, he's been a friend and a great supporter for the lab. There's a lot to be thankful when it comes to Kemal, and I think one of his best attributes, at least as far as we are concerned, is that he has great vision and he can see way ahead most of us. So happy Thanksgiving and thank you again for being there.
Hi, Kemal, it is me, your most favorite person, aka your number one. And don't worry, I will not tell anyone. On a serious note, On behalf of your Kriyas family, I would like to thank you for your passion, unwavering devotion, hard work, commitment, and sacrifices. It is truly your leadership that has brought us to great strides, and we are very fortunate and extremely proud to have shared every milestone with you throughout the years and are looking forward to many more. On a personal note, I also would like to thank you for being an inspiration to me, especially for bringing out the best in me. I also would like to express my heartfelt gratitude for treating my family as your own. I can never thank you enough for that, Kemal. Thank you very much for everything. We love you. Happy anniversary.
Hi, Kemal. Just wanted to say happy Thanksgiving and thank you for all your guidance and support. And I also have someone here that wants to thank you as well. Thank you, Kemal. Happy Thanksgiving.
Kemal, I want to take this moment to say thank you. I am so thankful for my job and being employed at United Medical. I am thankful for my great coworkers and my wonderful boss. Honestly, it makes it easy to come to work every day when you're surrounded by such good people. Also, I'm extremely thankful for a very generous boss. Over the years, I have worked for many companies, and none have been as generous to their employees as this one. Whether it be through hosting your holiday party so we can celebrate together, or letting us have a company outing to a baseball game, giving us a day off when we didn't expect it, giving us all jackets, or by simply letting us come together to be silly during Spirit Week, where we have a common denominator and we can come together and feel connected and feel like a team. You've created that environment, so thank you. Also, I feel extremely fortunate that I have a boss who leads by example. You give back to your community, you give generously, and you give humbly. You have passion for the organizations that you support, and you are constantly asking what they need, how you can meet that need, and then you do meet that need. It's truly inspiring, Kemal. So with all that being said, I just want to say thank you for all you do, and most of all, thank you for being you. Happy Thanksgiving.
Oh, so, well, thank you. Wasn't expecting it. This was nice. Thank you again.
You call.
I will see you guys. I think next week we're off. I wasn't really expecting it, so it's done really nicely, and I do appreciate everyone. We are thankful. I am thankful